All right. Well, I think we'll go ahead and get started if you guys don't mind. So obviously we're going to be talking to you guys about wildfires today. I am Kevin Watkins.
My name is Alyssa Valentine.
I'm Gail Kuklis.
So our learning objectives overall are to discuss how climate change impacts wildfires and positively reinforcing them, learning the various impacts, health impacts of wildfires, understanding how frontline workers can protect themselves while treating patients and advocating for the planet, and then if we have some time, maybe have a discussion at the end as well.
Alrighty. So, the majority of us have been impacted by wildfires either directly or indirectly. Just a few months ago, fires in Los Angeles took people's homes, livelihoods, and even lives. Um, More recently, fires burned on the opposite side of the country in the Carolinas. And even if you're not in the flames, people are getting impacted indirectly. So this is a picture of downtown Detroit in 2023 after wildfire smoke from the Canadian wildfires migrated into the area. At one point, Detroit had the second worst air quality in the world, even though the flames were hundreds of miles away. So why are fires occurring more and more frequently? Well, it's directly related to climate change. So with increased CO2 emissions, we have increasing temperatures. This leads to more evaporation, everything is drier, you have longer fire seasons. And then once the fire starts, this actually exacerbates the issue because more burning releases more CO2 into the atmosphere, and this just kind of makes this loop. So this is called the forest fire feedback loop.
And a little more background, there are a number, traditionally or historically, there are a number of wildland fires every year, tens of thousands, millions of acres burned, billions of dollars that are cost. Having said all that, roughly only about 20% require a federal response. Most of them are small fires that local jurisdictions manage. The five main agencies I have on here are the ones that overall may respond during a federal event. Having said that, each event is different. You may not have all five services respond to every single fire, and they are coordinated through this National Interagency Fire Center in Boise, Idaho.
Okay, so if we're talking about trends in wildfires, so not only are we seeing more wildfires, they're often lasting longer and they're burning much more intensely. I am a Californian, and so we've seen like the worst wildfires over and over and over and over again for the past couple of decades, and that's kind of a trend across the country. A lot of this has to do with the increased length of the wildfire season. So we're seeing fires earlier and later. Part of this has to do with precipitation or lack thereof, drier soil, and changes in vegetation. Some of that is drier vegetation. And then if you look in the Arctic, we're seeing actually more vegetation due to permafrost thaw. And so we're now seeing different patterns in where we can actually have fires burn. And we're also seeing changes in snowpack, earlier snowmelt, which further contributes to the earlier wildfire season, and then lower water availability.
And as mentioned already, so these wildfires aren't just affecting those in the local region. I'm from Wisconsin, and over the past several years, we've had some pretty poor air quality at times because of wildfires that are in Canada or out west. The smoke can travel thousands of miles, crosses borders. It even crosses oceans at times, and we're finding the effects even over in Europe at times during wildfire season in the United States. So, what are we talking about when we're talking about wildfire smoke? So, wildfire smoke is fairly complex and made up of a lot of different things. But what we're really talking about, and so when we're talking about the health impacts, what we're really talking about is the particulates in there, and particularly the particulates that are 2.5 microns and smaller, because these are the ones that can get deep into our lungs, into alveoli, and at times can even cross into the blood. These also make up the majority of the smoke that you're going to be encountering too. So the health impacts. As we learn more and more, we're finding that these impacts are affecting a lot of the systems in our body, and the more data that we get, the more systems we seem to find that are affected. And so we're going to talk about some of the obvious ones, but also then some of the newer research showing some of the new systems that are also affected. So kind of the big bad one we think about, mortality. I think it makes sense that if you're exposed to smoke over long periods of time, we can think that chronic diseases are going to lead to increased mortality rate. But some of the recent literature and literature from all over the world, and including meta-analysis, show that same-day mortality rates actually increase. And it's a robust enough finding that we're seeing it come through in our meta-analysis. Now the respiratory tract, I think this makes physiologic sense to us too, right? So smoke is going to cause irritation to our respiratory tract, and it's going to affect chronic disease as well as those that don't have underlying pulmonary disease. So increased rates of COPD, asthma, respiratory infections, and increased use of inhaler use, and even eosinophilia if you draw their blood. But I think what's interesting in the literature is how small an increase in this wildfire smoke can lead to some of these effects. So in as little as 1 microgram per meter squared, which I know probably doesn't mean a whole lot to most people, but when we're talking about these wildfires, these rates might be up into the 50s, 60s. So even an increase of 1 can start to see increase in the morbidity from the respiratory tract system. And so you can see why even those of us in Wisconsin or across the pond might still be suffering from these effects from wildfires that are far, far off. Now, the cardiovascular literature is a little bit more mixed. There does seem to be trends towards increased morbidity with cardiovascular morbidity, although a lot of the studies aren't showing necessarily statistical significance. However, there does seem to be physiologic basis under why this might occur too. So the smoke increases hypertension. It also seems to increase the instability or cause instability in the atherosclerotic plaques. And so we can see why this may occur. And we do consistently see some blips that this might also be increasing. Yet another concerning thing that's coming out of the literature is it does seem to have some morbidity with maternal and fetal outcomes. So it increases gestational hypertension, increases rates of preeclampsia, and when using controls, we're seeing that preterm birth and birth weights are down. Or I'm sorry, increased rates of preterm birth, but also birth weights are down. Now, this is an area that's an active research, and so we're getting some more and more data behind it. Some of the other areas that we're starting to see some evidence, and I think more and more will come along, is from the infectious disease side of things. Not only does it seem to affect our immune system, but it also might be a vector. So this particulate matter might also be a vector that can actually transmit infectious disease over long distances. Cognition. This also, even acute exposures, which makes sense, can have cognitive effects and then exacerbate or produce behavioral health disease as well. So even well-controlled chronic behavioral health diseases can lapse into an exacerbation, such as there's some data behind schizophrenia, et cetera, once patients are exposed to this smoke. Now, as with everything, when there's a problem in the world, we seem to see it, right? So you can see that data in the emergency department as well. And we're seeing increased ED visits. And then something else we're very well aware of is all the other limitations that we're dealing with on a day-to-day basis. In the emergency department, this just seems to add and compound to those effects.
So we're going to work on wrapping up our last topic, looking at our frontline providers themselves. Wildland firefighters have a very difficult job, and they were kind of ignored, actually, until the last decade or so as far as their health. They have a very difficult job a lot of times. Their gear, their Nomex gear, is not very breathable. They don't usually wear a respirator because the conditions they're in, right? Wildfire season usually is hot and dry, and they're working hard in these conditions. Their gear is usually over 40 pounds and sometimes northward of 100 pounds. And they're often working for 2 straight weeks and then having about 2 days off at a time. And their days are about 12 to 16-hour days. So you can imagine being in this gear for 12 to 16-hour days for 2 straight weeks. And additionally, they're usually, it's not uncommon that at these camps, so they don't come back to like nice buildings with showers and everything else. So they are living in these camps, staying there overnight, and then getting back to work early in the morning. I don't really want to go into the details too much of the different types of wildland firefighters, but I do want to recognize that there are different types. They have different jobs, although they can be overlapping depending on the situation. Having said that, they all deal with some of these same stressors. Starting with our fatalities, and really when we look into the data for our frontline providers, our wildland firefighters, it can be a little bit difficult because there are different databases that collect differing information. So you see a couple of graphs on some of my slides here. But if we look at fatalities, we may intuitively think that traumatic injuries are going to cause most fatalities. And in reality, more recent years, it's been more medical events in particular. It used to be trauma, but it's become more medical events and usually heart attacks. And these are typically in your volunteer firefighters that are middle-aged. So we actually see a lot more medical events in these folks that lead to their deaths. One thing to keep in mind too is that sometimes we think of some of these medical issues as very treatable because we see them and treat them, but remember they are often out in very remote environments away from care. So we've had a number of deaths of things where they have arterial lack and nobody gets a tourniquet. They're out in the woods. They can't just medevac them out very quickly because they got to extract them out of the woods first. So those are important things to keep in mind in what they're dealing with. The injury mechanisms, I think, are a lot more intuitive overall. There are a number of injuries every year. The majority of them aren't serious, so to speak, meaning only about 15% require missed work or restricted work. Having said that, if you have a large number of injuries, even a small percentage leads to a large number of time off. So it's estimated that the U.S. Forest Service, for instance, loses greater than $35 million annually. And it's no surprise, slips, trips, falls are usually how they get injured. They're working in very hilly or mountainous terrain, rocks. There's a lot of vegetation that they're dealing with. And a lot of these injuries often occur near the fire line itself. And then looking at the injury types, again, zero surprise there. Most of these are lower extremity injuries. They, interestingly though, tend to occur in less complex fires, so there's different grading of how complex fires are, and we don't know exactly why, but it's thought that the more complex fires have more attention and resources, and so there are less injuries overall. The other thing I do want to kind of point out that I thought was really interesting is that it's very common that they have issues with poisoning or environmental concerns. We may think of things like heat stroke, but actually heat illness is somewhat rare in these folks. This is actually looking more at things like some of our bees or wasps, or actually in a lot of cases our toxicodendrons. It's very prevalent on the West Coast, and CAL FIRE loses millions of dollars every year in their wildland firefighters dealing with toxicodendrons. And then lastly, looking at some of their medical issues, this has been some of the least studied topics, but has become more in focus recently. And a lot of this, in some respects, mirrors what we see from the smoke effects overall. They have declines in lung function. Interestingly enough, a lot of the studies show that that is relatively temporary, meaning if they get out of that environment, they may recover their lung function on spirometry. Infectious disease, the coccidioidomycosis, there have been multiple outbreaks of that. If you think they're digging a fire line, so they're digging in the dirt out west in these conditions, you're kicking up those pores, and so there have been multiple outbreaks of that. Our cardiovascular disease, as Tim P. mentioned already, the data is a little bit more mixed, but they do have higher rates of hypertension, probably from the oxidative stress of the PM 2.5, and they look like they have higher cardiovascular mortality. Our mental health is something that has been really much more recent as far as something that's been looked at. A lot of these folks deal with very stressful jobs, stressful work environments, and we know that causes a lot of rates of depression. We have been there to some degree. The interesting bit is that they actually have a high risk of suicide in the off season, which may not intuitively make sense, but if you think about it, they are away from their brotherhood, so to speak, people that understand them, and I think we probably get that too, right? We are all here, we kind of like coming to conferences where we get to meet people that understand what we go through with work, and it's, I think, very similar with them. And then lastly, cancer has less strong data than probably is anticipated. There is slightly higher rates of some of the skin cancers. There is a little bit of higher rate of lung cancer mortality, but in looking at some of the other cancers, they've not shown actually any statistical significance so far. But like I said, a lot of these topics are not well studied. So wrap up.
Okay, so that all sounds horrible. I try to put like a little bit of positive stuff into whenever I talk about climate related issues, just because I think a lot of us get really doom and gloomy about it with good reason. But there is a lot that we can do, right? So, like, if you're looking at your patients, yourselves, your family, if you're looking at your health system, or if you're looking at your community, there's different ways that we can prepare for this. So, like, if you are in a place that is exposed to wildfires, how can we educate our own communities? How can we educate our health systems? So looking on the individual level, like, let's connect folks to an air quality monitoring system. Most weather apps now have an AQI, right? Like, teaching people what that means, when you should avoid it based on your health conditions, when is a good time to stay inside, when you should be wearing like an N95 respirator, something like that. Knowing that N95 respirators are not something that have been studied for wildfire smoke. They're like very different than, the smoke composition is different than structure fire. And then also kind of just like maximizing your own personal health to provide some protective benefit when you're exposing yourself to these risks. If you are going to be stuck inside for a long time, making sure you have food, water, supplies, any sort of medications that you need. And then ensuring that you're reducing your smoke exposure, right? So, like, let's make sure that we're paying attention to these AQIs. Unfortunately, this means a lot of time spent indoors rather than outdoors. Things like indoor air filters can be really helpful. There is also like a lot of online videos that can teach you how to make your own air filters. Especially if we're thinking about our patients, right? Like, air filters are expensive. A lot of them don't necessarily have access to that. So teaching them like how to use a box fan to make an air filter can be something that's really helpful. And then if you can get a respirator, that's great. They will definitely help, but we just don't know how much. If you can relocate, cool, but like that's really hard, right? For everybody. Like, you have your job, you have your family, you have like everything. So like that's like a great thing to theorize, but let's be realistic. If you are someone who is working within your health system, first and foremost, educating your colleagues, right? Like, this is very much a health emergency, and making sure that everyone who you're working with understands that. If you can get some sort of like disaster response team in place, that can be really helpful. And you can create these like kind of early warning systems. There are a lot of pre-existing toolkits. Like, AmeriCares has a really excellent wildfire smoke toolkit that you can direct towards your patients, and then also towards like clinicians and healthcare administrators. There are many similar things like that that provide these like really well done outlines to provide some preparedness. If you have the ability to like dedicate part of your clinic or part of your hospital to being a clean breathing space, that can be really helpful to patients. So we have cooling centers for heat emergencies, right? Why can't we have breathing centers for smoke emergencies? And that's something that, like, if you already have these dedicated spaces to cooling centers, like, use the same thing. And then within your community, so a lot of that is like the discussion between the health system and public health. I think that can be a really great overlap. They're often trying to achieve the same things with different resources. And if you are in your health system making a wildfire preparedness plan, you should absolutely involve the DPH, right? Like, this should be part of your conversation. You should involve EMS. You should involve kind of like as many stakeholders as you can to create that plan. And then identifying who's most at risk. So people who work outdoors, people who work in poorly ventilated areas, people who are unhoused, people who are elderly, people who are really young. Making a list of those people who are most at risk of having exposure to these and having poor health outcomes from exposure, and then ensuring that those people are highlighted in your plans. And then figure out a way to distribute information. Tap into your community resources, tap into your nonprofits that you work alongside. A lot of the social workers that we work with are really well integrated into the community and are excellent resources for connecting you and making sure that you can like get this information out to people who really need it. I think that's kind of a good summary there. Does anyone have any questions?
Interest group meetings?
Yeah, you can show it now or later.
What?
You can say it now or later too. Or next talk too. All right. All right, and we will be having, we were both represented from the Wilderness Medicine and Climate Change interest groups, and we will be having our business meetings tomorrow. So make sure to look on the schedule if you're interested. All right.
Awesome.